Sween Cream is a moisturizer used to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, reducing itching and flaking. Some ingredients, like zinc oxide and white petrolatum, are used to protect the skin against irritation. Dry skin is caused by a loss of water in the upper layer of the skin. Sween Cream works by forming an oily layer on the top of the skin that traps water in the skin. It contains common emollients like petrolatum, lanolin, mineral oil, and dimethicone. It also includes humectants like glycerin, lecithin, and propylene glycol, which draw water into the outer layer of the skin. Additionally, it has ingredients that soften the top layer of skin cells, helping the dead skin cells fall off and leaving the skin feeling smoother and softer. When using Sween Cream, make sure to follow the directions on the product package. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on your skin condition and the specific product you are using. If you are using the cream for dry hands, you may need to apply it every time you wash your hands throughout the day. For diaper rash, ensure the diaper area is clean and dry before applying the cream. If using the cream to treat radiation skin burns, check with radiation personnel before application. Only apply the cream to the skin and avoid sensitive areas such as the eyes, mouth, nose, and vaginal/groin area unless directed otherwise. Follow the label directions and consult your doctor for more details. For best results, use the cream regularly and apply it to damp skin, such as after bathing or showering. If your skin is very dry, your doctor may advise you to soak the area before applying the cream. Avoid long, hot, or frequent bathing as it can worsen dry skin. If your condition persists or worsens, or if you have concerns about a serious medical problem, seek medical help immediately. While using Sween Cream, some people may experience a burning sensation, stinging, redness, or irritation. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist immediately. If your doctor has prescribed Sween Cream for you, they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects, but it is important to seek medical attention if you notice any unusual changes in your skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's important to consult your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Sween Cream, make sure to check with your doctor or pharmacist if you are allergic to any of the ingredients. This product may contain inactive ingredients that can cause allergic reactions. If you have any skin cuts, infections, or sores, it's important to consult your doctor or pharmacist before using Sween Cream. Some ingredients in Sween Cream, such as preservatives and fragrance, may make you more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you get sunburned or have skin blisters or redness, be sure to contact your doctor right away. If you have acne-prone skin, look for the word non-comedogenic on the label, as some products may worsen acne. Additionally, some products may stain or discolor clothing, so it's important to ask your doctor or pharmacist for more details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to let your doctor know before using Sween Cream. Additionally, if you are applying this product to the breast area, consult your doctor before breastfeeding, as it is unknown if Sween Cream passes into breast milk. When using Sween Cream, it is important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. It is recommended to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It is crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines to ensure your safety and well-being. If this medication is swallowed, it can be harmful. If someone overdoses and experiences severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention. For residents in the U.S., they can contact their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. To help prevent dry skin, it's important to use lukewarm water when bathing and to take baths or showers less often, such as every 1 to 2 days. Keeping baths or showers short and using a humidifier when the air is very dry can also be helpful. When it comes to emollient products like Sween Cream, there are various types available, including oils, creams, lotions, or sprays. Some may contain fragrance or other ingredients that could cause sensitivity in some individuals. It's best to consult with your doctor or pharmacist to determine which product may be most suitable for your needs. If you are using Sween Cream on a regular schedule and miss a dose, use it as soon as you remember. Do not use more product or use it more often than directed to catch up. Be sure to follow the storage instructions on the package and keep Sween Cream away from children and pets. Do not store the foam canister near high heat or open flame, and do not puncture or burn the canister. When you no longer need the product, make sure to dispose of it properly by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.